to invite our next speaker to the stage. She is one of the bravest doctors I know because she has stepped out of the NHS to follow her passion and treat her patients how she knows is best. And that is Aryan Tavakkoli.
Good afternoon, everyone. Like Brenda Davis this morning, I have a slightly funny throat, so please excuse me if I need to cough during the talk. I will do my best. As Dr. Kassam just said, my name is Aryan Tavakkoli. I'm very happy to be speaking with you today about cancer and what can be done to help anyone you know who may have cancer in addition to conventional treatment. It's a subject that's very close to my heart, as I'm sure it is with many of you. So my background is that I am a specialist in respiratory medicine. I've been a doctor for almost 30 years now, and for much of that time I've worked as a consultant in respiratory medicine within a standard hospital career. I chose to leave my hospital post because, and open my own clinic, Quantum Clinic in East Sussex, really because I wanted to be able to offer more to my patients than I was able to offer within a hospital setting. So at Quantum Clinic, I see people with cancer and I support them using an integrative medicine and functional medicine approach. Integrative medicine is about finding the best solution to a problem using both conventional treatments and evidence-informed non-conventional therapies. And functional medicine is basically root cause medicine. It's about looking for the underlying issues that may have been present and that may have caused a disease to arise in the first place. I should just clarify, I'm not an oncologist and I don't offer alternative treatment for cancer. So how I see cancer now, I don't actually see cancer as a disease. I see cancer as a symptom of underlying issues that must have been present in the body for a long time before this condition that we call cancer finally appears. I'm not going to dwell on the statistics. We all know that cancer rates are rising, but I'm just going to show you where we stand in the UK compared to other countries. And these are the 5-year survival rates for breast cancer. And if I tell you that the laser doesn't really show on the screen, but the line at the bottom there is the country doing least well, which is Ireland, and the country leading the statistics right at the top is the United States. You might be able to see from the key that United Kingdom is second from the bottom. In fact, at the moment, at least when these figures were collected, we're now third from the bottom. That was in 2014. Now, in terms of percentages, it's only a few percent, so 85% in the UK compared to about 90% in the US. But in terms of absolute numbers, that's several thousand lives a year. So, you know, that's a very significant difference, and it shows that clearly we can make significant improvements here. At the time of a cancer diagnosis, of course, it's completely normal to experience all of these emotions and more. And much of the time, it can be treated with conventional treatment, so surgery, chemotherapy, and radiotherapy, but not in all cases. So a lot of the time, either the treatment fails or the cancer has advanced to such a degree that only palliative treatment can be offered. And in these circumstances, the patient is described as having terminal cancer. And usually the picture is quite grim from then onwards. At this point, I would like to share with you some information about people who have achieved complete remission after a diagnosis of terminal cancer. These people do exist. And the question is, what did they do? And it's a question I think all oncologists should ask their patients who seem to be doing much better than expected. It's a question that a Dr. Kelly Turner asked over 1,000 people who either achieved complete remission after a diagnosis of terminal cancer or who were doing far better than their perceived prognosis. In the medical literature, this is called spontaneous remission. But of course, there's nothing spontaneous about it at all, because once cancer has reached such an advanced stage, it's just not going to disappear by itself. You have to do something. And what she found when she interviewed these people was that they had certain similarities, 9 similarities to be precise, which we're going to look at in a minute. But just bear in mind, please, that these 9 things are not the only things these people did. They're their shared characteristics of the people who did achieve complete remission in a situation which was deemed to carry an extremely poor prognosis. So what did these people do? well, not surprisingly, they all changed their diet. Specifically, they either completely eradicated or significantly reduced sugar, meat, dairy, and refined foods. And at the same time, they significantly increased their intake of fruits, vegetables, organic foods, and filtered water. They took control of their health. So radical remission survivors, as Dr. Turner calls them, they were certainly not passive people. They would listen to conventional wisdom, but they wouldn't stop there. They would research, they would look at all possible avenues. They were very proactive in their own healthcare. They followed their intuition. I'll let you read that quote. So radical remission survivors found it extremely important to listen to their gut instinct when deciding on the right treatment plan for them. They used herbs and supplements to strengthen their immune system. They recognized that cancer cells can only thrive in certain conditions, and they used certain supplements to change their internal physiology in order to make it less habitable for cancer cells to thrive. Now, I know this is a controversial area. There is a lot of laboratory data on certain phytochemicals that have strong anti-cancer action, but the reality is that they will almost certainly never make it into national guidelines because nobody's going to fund the large-scale clinical trials to prove these things. So the lab data is certainly there for a lot of phytochemicals. This could take up a whole conference talking about supplements. Clearly we're not going to do that. So the one thing I would say is always work with a healthcare professional who's researched this area really thoroughly and who can really advise you well which supplements may benefit you and which ones to avoid. They release suppressed emotions. So these are usually emotions we carry from the past, usually negative emotions such as bitterness, anger, or regret. We know that the stress hormone cortisol, which is released by our adrenal glands, is a cancer driver. So anything that reduces stress and reduces cortisol release is going to be beneficial. And these people realize that they really need to let go of those emotions that they're hanging on to. At the same time, at the same time, they increase their positive emotions. So when we increase emotions such as hope, such as gratitude, such as forgiveness, it actually makes a physiological change in our bodies. It impacts on our heart, on our hormones, on our immune system. And this physiological change has been studied and has been shown to improve the outcome of many chronic conditions. And there's a technique called heart math, which I would recommend to you. You can find videos online. They embrace social support. So for a lot of people, this could be just close family support. For other people, it meant joining community support groups. The importance of physical touch should not be underestimated. A massage or a stroke or a hug, even laughing, all of these things increase the activity of our natural killer cells, which are the cells in our immune system that recognize and eradicate cancer cells. They deepen their spiritual connection, whatever that might mean to them. It might mean God, it might mean a universal force, it might mean an inner energy, but in whatever way felt right to them, they connected with some sort of deeper, higher wisdom. And they all had very strong reasons for living, whether it was to stick around their children or grandchildren or to finish a project or whatever. Now, there's something very important I want to point out about those 9 similarities, and that is that 7 of them are related to mind and emotions. I know this is a conference on nutrition, and I will get to that shortly, but there is one thing that I would place ahead of even whole food plant-based nutrition when it comes to dealing with cancer, and that is the mind. Our mind is the most powerful therapeutic tool that we have, and it's very often ignored in medical consultations. For me, it should be right up there as the first thing to be addressed, both in terms of addressing mental and emotional issues that might be possibly hindering recovery, but also in terms of harnessing the power of the mind in achieving wellness. So I just want to spend a moment or two just looking a bit more closely at why it's so important to make sure we address the mind in any therapeutic strategy. I'm sure you're all familiar with the functions of the different sides of the brain, and under the right brain functions there, I would just add imagination. And the effect of imagination on the brain has been studied in numerous studies. This is one of them. So these people were scanned using something called functional MRI scanning. Their brains were scanned. The people on the left there were asked to look at drawings of simple objects while their brain was being scanned. The people in the middle were asked to just imagine those objects that were being described to them. And what they saw was that exactly the same areas of the brain lit up, whether the people were actually looking at the drawings or whether they were imagining them. So what this seems to suggest is that our brain doesn't differentiate between reality and imagination. So we're just going to test that out. We're going to check the power of your imagination. It's a simple 2-minute visualization. And if you'd like to take part, I'm just going to ask you to gently close your eyes and imagine that you're holding a lemon in your hands. You can see all the features of this lemon very clearly. It's a perfect colour of yellow. You can see the pores in its skin. You can see how the light glints off the skin. Now imagine putting the lemon onto a cutting board and with your other hand taking a knife and cutting the lemon in half. You notice a spray of lemon juice entering the air. It enters your nose. It's so vivid that you can almost taste it. Take the knife again, make another cut into the lemon. Notice again how the lemon juice flows out and now how you can smell the zesty freshness of the lemon. And now pick the lemon up, bring it closer to your mouth and take a big juicy bite out of it. Now open your eyes and hands up, who in this hall is not salivating right now? So you see how your brain creates a physiological response based purely on your thoughts. There's not a lemon in sight. Now what if the subject of your imagination was not a lemon? What if the subject of your imagination was your immune system? Can we actually stimulate physiological responses in our immune system using our thoughts alone? Yes, we can. That's been studied a lot as well. In the interest of time, I can only show you this one study. So this is 80 women with breast cancer who were undergoing conventional treatment, and the intervention group was shown how to visualize their immune system. So they literally imagined their natural killer cells, identifying their cancer cells and eliminating them. And they would carry out this visualization exercise several times a week for several weeks. At the end of that time, the researchers took blood from the intervention group and from the group of women who didn't do that exercise. What they found was that the natural killer cell activity had increased in the group who had done the visualization exercise regularly. And there were various other immunological changes. Now, this is really fascinating stuff. For me, it's really fascinating. It shows a whole new area that we could potentially use. Unfortunately, I can't dwell on it because I need to move on. So we're going to move on now to nutrition, the topic of this conference. And if you were here yesterday, you would have heard Dr. Kassam's excellent talk on nutrition and cancer. I'd like to focus particularly on nutrition after a diagnosis of cancer, and in particular the role of high-fat diets on the long-term impact of cancer. Ketogenic diets, as we've just heard from Dr. Clapper, have become quite popular recently, especially in the Integrative cancer circle. Part of the reason for this is because there is data showing that tumour size can reduce on a ketogenic diet in the short term. But the long-term impacts haven't been taken into account, and in fact there is no long-term study showing the safety of ketogenic diets in cancer. On the contrary, long-term data consistently shows that high-fat diets are linked to poorer outcomes and reduced survival in cancer. So fat is actually a necessary part of the spread and metastasis of cancer. And the mechanism for this has actually been identified. So it's no surprise then that in the top meta-analysis on nearly 10,000 women on breast cancer, there was nearly a 25% reduction in recurrence of cancer in the women who followed a low-fat diet compared to those who followed a high-fat diet. And in the bottom study, a randomized controlled trial of nearly 50,000 women followed up for 16 years, there was almost 50% reduction in mortality in the women who followed a low-fat diet. This is very strong data. This is long-term data. It's very difficult to ignore. And in this study, this is a meta-analysis of over 100 studies, over 200,000 cancer survivors. And what they found was that the people who had lower mortality and lower risk of recurrence were the ones who were following what's known as a prudent diet. So it was defined as a diet high in fruits and vegetables and whole grains and low in meat and fats and refined grains. And although this bottom quote isn't formally in that study, talking about the next slide. So the World Cancer Research Fund, it's really good to see that they're also taking on these recommendations and this is both for prevention of cancer and after a diagnosis of cancer, to eat more whole grains, fruits and vegetables, beans, and low intake of any of meat. That's the quote I was talking about. That's not formally in the guidelines, but the medical and scientific advisor of WCRF did actually say publicly that the evidence on processed meat and cancer is clear-cut, and the data show that no level of intake can confidently be associated with a lack of risk. In my own clinic, I do encourage my patients to move on to a whole food plant-based nutrition. To be fair, almost all of them have done so much research before coming to see me, they're all pretty well versed on nutrition. So they're all 70–80% plant-based already. I just encourage them to take that step further and take out the fish and the fish oils and the organic meat and the eggs, etc. And to their credit, almost all of my patients listen to me and they move on to whole food plant-based nutrition. I give them advice in the clinic setting, I follow up with written recommendations. I have whole food plant-based cookery books in clinic, which a lot of them borrow, and I link them up with whole food plant-based nutritionists for ongoing guidance and menu planning, etc. And that's been working really well. At one point I got very frustrated because I kept hearing people talking about this terrible bone broth, and so what I did is I looked at the elements of bone broth to see what was deemed to be beneficial, and I decided to reinvent a plant-based version, which I creatively named Better Than Bone Broth. And the link is there for the recipe if you're interested in knowing that. So I want to move on now to tell you about some people who have achieved complete remission after a terminal diagnosis of cancer, or who are living with cancer as a chronic disease, much like one does with diabetes or heart disease. These are public figures, by the way, and I'm telling you their names so that if you know someone with cancer, you can tell them about these people. They can read up about them and be inspired by their stories, because stage 4 cancer does not have to be a death sentence. So people like Sophie Savage, who was diagnosed with stage 4 non-small cell lung cancer back in 2014. At the time, she had metastases to the brain, the bones, the lymph nodes, and the lungs. She describes herself as a stage 4 cancer thriver. She says, I have cancer, cancer does not have me. And she's written a book. She's become known as the Cancer Whisperer, and she's written a book of the same name there. People like Ivelisse Page, who was diagnosed with stage 4 colorectal cancer back in 2008. She's been cancer-free for 10 years now. And mistletoe, which is an unlicensed agent here in the UK, was a very large part, it was a major part of her therapeutic strategy. And she's become a major driving force for a clinical trial on mistletoe in cancer at Johns Hopkins in the US. People like Jane McClelland, who was diagnosed with stage 4 cervical cancer back in 1994. She started studying hundreds and hundreds of research articles, published articles, on what's known as repurposed drugs. So these are commonly used medications for other common conditions, but that are known to have anti-cancer action as well. So she put together a cocktail of drugs and did a lot of other things, changed her diet, changed her lifestyle, etc., and watched her cancer melt away. She's been cancer-free, I believe, since 2004. She's written a book, How to Starve Cancer Without Starving Yourself, which is all about blocking the metabolic fuel pathways of cancer, using diet, using supplements, using repurposed drugs. The metabolic pathways of cancer are extremely complex. We really don't understand it completely. And the thing is, cancer cells are very metabolically flexible as well. So if we just block a pathway or an enzyme, which is what we tend to do with chemotherapy, with time, the cancer will just find other pathways to move on to obtain its fuel supply. So this is often why we see a recurrence of cancer after chemotherapy. And these repurposed drugs are very slowly beginning to edge their way into conventional medicine, very slowly. There is a wealth of data behind them in the medical literature. So I'm sure you'll recognise some of those medications. Atorvastatin is a statin, it's used to reduce cholesterol levels. Metformin is a diabetes medicine, mebendazole is an anti-worming drug, proxycycline is an antibiotic. All of those have potent anti-cancer potential and activity. And the one clinic that does prescribe these in the UK that I know of is Care Oncology Clinic in London. They prescribe it as part of an approved trial for people with cancer, along with their conventional treatment. If you want to speak to people, to stage 4 cancer thrivers, and you want to know what they did, or if you just want to know more about how an integrative approach can help someone with cancer, True Fields is the place to go. It's held every July in Surrey. It's a very uplifting and informative event, and all the food there is plant-based. A couple of other resources for you. These are the 2 largest integrative cancer charities in the UK. They're not fully plant-based, but Yes to Life does have a vegan chef who provides whole food plant-based recipes to their patients with cancer, and Cancer Active also promotes a mainly plant-based diet. So where to from here? So there's plenty of things that can be offered to people with cancer at the moment, but we're still seeing about 500 people dying every day from cancer in the UK alone. I think that we will improve significantly on this figure, but not the way we're doing things currently. So I'm going to put the question out there. What if all our patients with cancer were offered the same interventions as those radical remission survivors? What if all our patients were encouraged to move to whole food plant-based nutrition? What if mind-body therapies were offered to all of them to harness the power of their mind to achieve wellness? What if they were offered targeted anti-inflammatory and anti-cancer supplements and repurposed drugs to block off all those metabolic pathways in addition to standard treatment? What if they were offered certain phytochemicals like mistletoe, unlicensed, as I said, in the UK, but one of the most commonly used complementary treatments for cancer in Europe, and with a wealth of data behind it? What if they were offered other evidence-informed integrated therapies, like hypothermia, like hyperbaric oxygen, again, commonly used in Europe? What if all of them had detailed testing to look at their underlying physiology, to look at their gut health, their gut microbiome, their hormonal metabolism, their nutritional status, and all of those areas were optimized physiologically for them? What would happen then? Well, I think the examples I just showed you show what potentially could happen with this comprehensive integrative approach. This is actually a grassroots movement. There are a lot of people with advanced cancer in the UK who are actually travelling abroad to Europe and further afield to seek clinics. They're actively seeking clinics to help them help themselves. It's something that is not offered to a great extent here in the UK. I have no problem at all with conventional treatment for cancer, but I do think there's a huge amount of information that isn't being offered to people with cancer that potentially could make a huge difference to them. And the clear understanding in integrative medicine clinics is that cancer really does need to be addressed in a very comprehensive fashion. There are many areas that need to be addressed. It's really not enough to just block a pathway, to block an enzyme, and to expect it never to come back. I think that this is the future of medicine. I think that we're going to be moving away from chemotherapy, radiotherapy. I think we're going to be moving towards nanotechnology and the use of nanoparticles and waves and frequencies. I think that in the not so distant future, people with advanced cancer will be able to lie down in devices that work using nanoparticles or other substances that are stimulated and activated by certain wavelengths and frequencies, and that cancer deposits all over the body will melt away within a matter of minutes. Just like that. And I think that this will be achieved in our lifetime. In the meantime, certainly in my own clinic, I continue to support people with cancer by supporting their physiology, their nutrition, their gut health, their hormones, their immune system, and I offer a number of other complementary therapies to go along with their standard treatment. I wish I could dwell further on what I do in my clinic, but I would like to leave a few minutes for questions, and I thank you very much for listening to me.